Yes, now we have completed the superficial layer of anterior forearm superficial flexors. Now we'll go into deep flexors of anterior forearm. So now we'll study the deep flexors of the forearm. So for the clarity of the understanding, we have to start from the deepest layer. So we will remove the superficial muscles and start really from the really depth. That is in the deep there is a membrane called interosseous membrane, which is located between radius and the ulna. This is interosseous membrane. It is located between radius and the ulna. It provide additional support to these bones. This is your interosseous membrane. It provides additional support to these bones during pronation and supination. Also, they provide site for attachment of some of the deep flexor muscles. So, as you can see here, their location is in the very deep position in between radius and ulna, radial shaft and ulna shaft. This membrane, interosseous membrane, made out of fibrous membrane made out of several components, including thick central band and smaller accessory bands, with some variation in structure. So these fibers are oriented obliquely, which allows them to become taut and shift loads when force is applied. So their main function in this muscle main function is load transmission, forehand stability, providing site for muscle attachment, and supporting in pronation and supination. So this is the first deep muscle structure we can understand. This is interosseous membrane. So now when you come down to the distal area, the depth, there is a muscle called pronator quadratus. It's a small muscle. It's actually very deep. It's lie on the bone. It's quadrilateral shaped muscle in distal part of the forearm, anterior compartment. It's originate on the anterior surface of the distal ulna and insert on the anterior surface of radius. Okay, it covers the anterior surface of radius and ulna. So this, as its name suggested, it supports pronation. It supports the pronation and stabilizing the radio while during pronation, stabilizing the radioulnar joint. This muscle is innervated by the anterior interosseous nerve. Anterior interosseous nerve is a branch of the median nerve. So this muscle is crucial for forearm movement and is sometimes its use in reconstructive surgery due to its consistent anatomy. So this is what we discuss here. It's origin the distal fourth of the anterior surface of ulna, and it insert into the distal fourth of the anterior surface of radius, innervation from the AIN, anterior interosseous nerve, and blood supply from the anterior interosseous artery. Main function is pronation. It works with the pronator teres to pronate the term the palm, the forearm, pronation of the forearm. And the deep fibers of the pronator quadratus help to bind the radius and ulna together at the distal radio-ulnar joint. So this muscle is very crucial for the distal radio-ulnar DRUJ joint stability. Coming to our next muscle, it is flexor pollicis longus. This flexor pollicis longus and flexor digitorum profundus covers the deeper structures, so it lies over the pronotal quadratus. The FPL is a part of deep layer of the anterior compartment or the volar compartment of the forearm. You can see this muscle originates from the radius and volar surface, from the anterior surface of the radius, volar surface of the radius, and the interosseous membrane. It has connection to interosseous membrane, and this muscle runs all the way to up to the distal phalanx of the thumb. So its insertion, its tendon travels all the way to the distal phalanx of the thumb, and its insertion is the distal phalanx of the thumb. So when considering the nerve supply to this muscle, it gets innervated by the anterior interosseous nerve, a motor branch of the median nerve. So flexor pollicis longus receives its blood supply from the anterior interosseous artery. The primary action of the FPL, flexor pollicis longus, is to flex the thumb, and specifically at the distal interphalangeal joint, DIP joint. It also contributes to the flexion of the metacarpophalangeal joint of the thumb. So this is one of the flexors of the anterior forearm. So its flexor pollicis longus, it's lies in the volar aspect of the radius, originating from the volar aspect of the radius and the interosseous membrane, and it's insert into the distal phalanx of the thumb. Innervation from the AIN, anterior interosseous nerve, and supply, which is a branch of motor branch of median nerve, and blood supply from the anterior interosseous artery. So here we move further. The next muscle in the deep flexor compartment is flexor digitorum profundus. This flexor digitorum profundum is a deep muscle in the forearm. This muscle is responsible for flexing the distal interphalangeal fingertip and the metacarpophalangeal. So this muscle is originating from the proximal ulna, anterior and medial surfaces, and also there is connection with the interosseous membrane. So the origin from the proximal 1/4 of the ulna, anterior and medial surface, and interosseous membrane. So this muscle, as it goes down, it's divided into 4 branches, 4 tendons, and they insert the base of distal phalanges, okay, of the index finger, middle finger, ring finger, and little finger. So these tendon insert into the distal phalanx of the 2nd to 5th fingers. So this muscle lies deep within the forearm volar compartment beneath the more superficial flexor digitorum superficialis muscle. So its actions are the flexion, the grip. The primary action is the flexion of DIP and MCP joint of the all four fingers, okay, except for the thumb, and it plays a crucial role in the grip due to its tendon arising of the uh, rising at below the this place. It plays a main role in the FTP, plays main role in the grip. So when we discuss, as it's a deep muscle of the forearm, it has a special innervation. FDP has a dual innervation by both the median and ulnar nerves. So it allows for the powerful mass action needed for the strong grip. This is dual supply from the nerves. So what's the main point, salient point of it here? Flexor digitorum profundus. It's originate from the distal proximal ulna and the interossseous membrane, proximal ulna, medial and anterior surface of the bone, and the insertion at the base of the distal phalanx of the index, middle, ring and little fingers. It lies in the forearm's volar compartment beneath the more superficial flexor digitorum superficial muscle. Action is flexion and the grip. So when we are discussing the innervation, so deep flexors and their innervation, these flexor digitorum profundus get main supply the median nerve. It supplies the lateral part of the flexor digitorum profundus, which acts on the index and middle fingers. And again, as we mentioned earlier, it has dual supply. So ulnar nerve supplies the medial part of the FDP, which acts on the ring and the little fingers. So for the FPL, flexor pollicis longus, median nerve, median nerve anterior interossseous branch innervates the flexor pollicis longus, which is responsible for the flexing of the thumb. Then pronator quadratus, it also get nerve supply from the median nerve. It's branch, anterior interossseous branch. This muscle located deep in the forearm also received innervation from the AIN, anterior interossseous branch of the median nerve. So it get this is the summary. Flexor pollicis longus attached to the distal phalanx of the thumb, innervated by the median nerve. So flexor digitorum profundus attaches to the distal phalanx of four fingers, innervated by median and ulnar nerves. Pronator quadratus attached to radius and ulna, innervated by the median nerve. So now let's see the deeper dissection of the forearm. For our reference, this is this is a right forearm. So this is right forearm. So this side will be our lateral side, and this side will be our medial side. Okay, lateral and medial. Also we can name them as radial side. Lateral side is called radial side and medial side is called ulnar side. So these are our reference point. So in this dissection, superficial structures are removed. So now we can focus on our deep flexors. So here, first muscle which we are going to describe is flexor pollicis. So here you can see these flexors are cut, superficial flexors are cut. So that's why we can see the deep structures. These are tendon part and deep tendon also you can see here. So first muscle we are going to describe is flexor pollicis. Flexor pollicis longus. So you can see it here, flexor pollicis longus. You can see this muscle. This is the deep muscle, flexor pollicis longus. It lies in the radial side of the forearm and runs down to its attachment distal phalanx of the thumb. So this lies in the which side? Radial side of the forearm, and it runs downwards till its attachment in the distal phalanx of the thumb. Next muscle is flexor digitorum profundus. So you can see now so you can see how this muscle divide into its 4 tendons. So it's coming from up and it's at the somewhere midpoint of the forearm. It's divided into 4 tendons, and these 4 tendons make its way to 4 digits distal phalanx. So you see this is our radial side and this is our ulnar side. So this is our right forearm. So superficial flexors are cut here. So now there are distal tendons you can see here, and now you can identify the deep flexors, flexor pollicis longus and the flexor digitorum profundus in this dissection. Now we see some important structure which runs in this deep flexor compartment. They are neurovascular structures. So you can remember the studies which identified brachial artery in the arm. Now this brachial artery is crossing the wrist joint. It's entering the cubital fossa and it runs downward, and here just enter into the forearm. It's divided into its two main branches, radial artery and the ulnar artery. These are major arterial supply for the forearm. They also cross the wrist joint and supply to the hand. So these both arteries, radial artery and ulnar artery, they goes directly and they cross the wrist joint, and they also give the supply to the hand. So here next important structure which you can see is nerves. You all know now, usually in anatomy, we marked arteries in red color, veins in blue color, and nerves in yellow color. So you can see now this structure, it is marked in yellow color. So this is the structure you see. This is we call median nerve. So this nerve runs down just medial to brachial artery and then enters to the cubital fossa and rounds downwards to enter the carpal tunnel. So this nerve runs in between in the carpal tunnel and goes into the hand. So we can see another yellow color structure here. Is ulnar nerve. It's round downward in the medial aspect. It crosses the wrist to enter into the hand. Ulnar artery and ulnar nerve come close to each other in the forearm. So this structure, which we call flexor retinaculum, you will see now, this flexor retinaculum keep most of the tendon and nerves in their place. So this is flexor retinaculum. So this structure is important when you are in clinical practice, because when you are treating carpal tunnel syndrome, this is the structure you cut open to release the pressure in the carpal tunnel. So this is the flexor retinaculum. So here we see closer view in the deeper structures. Now we have removed these superficial layers. Now you are just hugging the bone. Now you can see the pronator quadratus at the wrist joint. So this is the small muscle quadrilateral shape. So you can see it's anterior aspect of the radius and ulna. So when you are doing surgeries in this area, you have to dissect out this, especially when you are doing distal radius fractures, when you are going to put a roller plate. So you have to cut from this one side and leave tipped, and then after the reduction you can reattach this muscle. So this is basically flexor compartment of the forearm. Now we are left with the two important topics of the arm, then we can complete the arm. Dorsal compartment, extensor compartment, and the hand. So next we will go into those sections.